Hey, blessed day, Grateful Gab family. Welcome into Wellness Wednesday here on the Grateful Gab podcast. If you don't know, every Wednesday I come at you with different health topics. It might stem from financial health, just regular body, physical health, mental health, all these type of things. If you're looking to get some wellness information here every Wednesday, come check out the Grateful Gab podcast. Appreciate y'all tuning in. Appreciate everybody love and support around the world. Before I get into Wellness Wednesday, we're going to get directly into the daily verse. Daily verse for the day of March 27th, 2024, derives from the book of Matthew, chapter 6, verse 33, and it states as follows. Keep on then, seeking first the kingdom and his righteousness, and all these other things will be added to you. Amen. And again, from the book of Matthew, chapter 6, verse 33. And this morning, ladies and gentlemen, for Wellness Wednesday, I begin this information from mayoclinic.org. Again, mayoclinic.org, and I'll be going over stroke. So, what is a stroke? An ischemic stroke occurs when the blood supply to part of the brain is blocked or reduced. This prevents brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. Another type of stroke is a hemorrhagic stroke. It occurs when a blood vessel in the brain leaks or bursts and causes bleeding in the brain. The blood increases pressure on brain cells and damages them. A stroke is a medical emergency. It's crucial to get medical treatment right away. Getting emergency medical help quickly can reduce brain damage and other stroke complications. Symptoms. If you or someone you're with may be having a stroke, pay attention to the time the symptoms began. Some treatments are most effective when given soon after a stroke begins. Symptoms of stroke include trouble speaking and understanding what others are saying, numbness, weakness, or paralysis in the face, arm, or leg, problems seeing in one or both eyes, headache, and trouble walking. Seek immediate medical attention if you notice any symptoms of a stroke, even if they seem to come and go or they disappear completely. Think fast and do the following. FAST is the acronym. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one armpit drift downward? Does one arm drift downward, or is one arm unable to rise? Speech. Ask the person to repeat a simple phrase. Is the person's speech slurred or different from usual? Time. If you see any of these signs, call 911 or emergency medical help right away. Causes. There are two main causes of stroke. An ischemic stroke is caused by a blocked artery in the brain. A hemorrhagic stroke is caused by leaking or bursting of blood vessel in the brain. Some people may have only a temporary disruption of blood flow to the brain, known as transient ischemic attack, or TIA. A TIA doesn't cause lasting symptoms. Ischemic stroke. This is the most common type of stroke. It happens when the brain blood vessels become narrowed or blocked. This causes reduced blood flow, known as ischemia. Blocked or narrow blood vessels can be caused by fatty deposits that build up in your blood vessels, or they can be caused by blood clots or other debris that travel through the bloodstream, most often from the heart. An ischemic stroke occurs when fatty deposits, blood clots, or other debris become locked in the blood vessels in the brain. Hemorrhagic stroke. Hemorrhagic strokes occur when a blood vessel in the brain leaks or ruptures. Bleeding inside the brain, known as a brain hemorrhage, can result from many conditions that affect the blood vessels. Factors related to hemorrhagic stroke include high blood pressure that's not under control, overtreatment with blood thinners, also known as anticoagulants, bulges at weak spots in the blood vessel walls, known as aneurysms, head trauma such as from a car accident, protein deposits in blood vessel walls that lead to weakness in the vessel wall. This is known as cerebral amyloid angiopathy, ischemic stroke that leads to a brain hemorrhage. Risk factors. Many factors increase the risk of stroke. Potentially treatable stroke risk factors include lifestyle risk factors, being overweight or obese, physical inactivity, heavy or binge drinking, use of illegal drugs such as cocaine and methamphetamine. Medical risk factors: high blood pressure, cigarette smoking or secondhand smoke exposure, high cholesterol, diabetes, obstructive sleep apnea, cardiovascular disease including heart failure, heart defects, heart infection, or irregular heart rhythm such as atrial fibrillation. Personal or family history of stroke, heart attack, or transient ischemic attack, and COVID-19 infection. Other factors associated with a higher risk of stroke include age. People aged 55 or older have a higher risk of stroke than do younger people. Ethnicity. African American and Hispanic people have a higher risk of stroke than people of other ethnicities. Sex. Men have a higher risk of stroke than women do. Women are usually older when they have strokes, and they're more likely to die of strokes than men. And hormones. Taking birth control pills or hormone therapies that include estrogen can increase risk. Complications of strokes. A stroke can sometimes cause temporary or permanent disabilities. You may have loss of muscle movement known as paralysis. You may have trouble talking or swallowing. You may have memory loss or trouble thinking. You may have emotional symptoms, pain, and changes in behavior and self-care. Prevention. Many stroke prevention strategies are the same as strategies to prevent heart disease. In general, healthy lifestyle recommendations include control high blood pressure known as hypertension, lower the amount of cholesterol and saturated fat in your diet, quit tobacco use, manage diabetes, maintain a healthy weight, eat a diet rich in fruits and vegetables, exercise regularly, drink alcohol in moderation if at all, and treat obstructive sleep apnea. And don't use illicit drugs. So again, ladies and gentlemen, I encourage you all to come check out this article for yourself. This has personally hit home to me and my family. And, it's not something I want to be able to see happen to anybody, young or old. So just make sure we're doing our best to be able to try to take care of ourselves. Again, make sure we're praying for Jehovah to, give us health, give us strength. But also make sure we're praying to Jehovah to ask for discipline to do what we have to do to be able to make sure we take care of our bodies. So just truly a blessing again for life today. Truly a blessing to be able to say that, my sister is surviving right now and overcoming this battle. And I know Jehovah has her in her spirits, and he's going to continue to, cover her and take care of her and her daughters. And he's going to continue to strengthen her, and he's going to continue to strengthen our family so that we may continue to come together as one and continue to all praise Jehovah and keep him at the head of our lives. So I love y'all. Y'all be blessed. Be grateful for life today. Don't take it for granted. Again, life comes at you fast and it can end fast. But be worthy of being able to be a citizen in the system that Jehovah is going to bring to this earth. A perfect world. So I love y'all. Take care of yourself. And until next time. Peace.